The Trump administration announced on Friday that the U.S. is rejecting a World Health Organization agreement that it says gives the global health body too much power. The agreement featured wide-ranging amendments to international health regulations. How does this impact you? Joining us to discuss is Reggie Littlejohn, attorney and founder at Anti-Globalist International, and Alex Newman, award-winning international journalist and the president of Liberty Sentinel Media. Good to have you both with us. We'll start with you, Reggie. Talk us through the impact of this decision on U.S. sovereignty, how the president sees it, and how you see it.
Well, the thing that I thought was very heartening was the words that RFK Jr. used, saying, "Are we going to allow the World Health Organization to use pandemic safety and medical safety as a Trojan horse to impose a biotech surveillance state?" Is basically what he said. That's a paraphrase, but that's exactly right. And that's the message that we have been trying to get across for several years. The International Health Regulation Amendments establish surveillance, they establish censorship, and they establish a system of digital IDs that could, in fact, lead to a biotech surveillance police state worldwide. And I'm so glad that the Trump administration has opted us out of that.
Okay, Alex, flesh this out for us, because I know you've been diving deep into this in terms of the UN in total, but also how we see it playing out in the World Health Organization.
Well, thank you. Great to be here. And I agree with everything Reggie just said. The World Health Organization is one of the primary tentacles of this global effort to really subvert national sovereignty and move more and more policy making up to the international level through centralized international organizations like the WHO, like the parent organization, the United Nations. And what the Trump administration has done here is incredibly significant. Now, I don't want to overstate the significance, because the reality is Trump will be president for 3.5 more years. And at some point, we'll have a new president in power. And that president, if things remain as they are right now, will have the ability to re-engage with the World Health Organization and ultimately put America under control of these efforts. But this is really extending the Overton window. It's really shifting the conversation. It's having dramatic impacts internationally. And I think it sets the stage for Congress to come in here and make some of these changes permanent in the next big piece of legislation that they do.
Okay, and I want to get both your takes, but Reggie, if we're just looking at this specific treaty that was, cast out, I guess, by the U.S. just now, what were some of the main elements that you were concerned about there? If you could dig into that more deeply.
Well, okay, the International Health Regulation Amendments and the Pandemic Treaty, two different documents, have to be read together. In terms of the International Health Regulation Amendments, they talked about establishing surveillance. You look at the treaty and it goes into One Health, meaning they're going to surveil human life, animal life, plant life, and the environment. They also talked about censorship. If you look over at the treaty, the Pandemic Treaty, it says that we are obligated, or that countries are obligated to prevent misinformation and disinformation, which is not just censoring it afterwards, it's stopping it from happening to begin with. And then the International Health Regulations establish a worldwide interoperable international system of digital IDs, which they say are for the sake of health. But if you go over to the World Economic Forum website, you can see a chart of what I believe is the full intent of the digital ID, which is that you're going to need one to open a bank account, to access healthcare, to travel, to buy and sell online, to own a communications device like a cell phone or a laptop, to vote, to access government benefits. It's going to control every aspect of life on Earth, and I'm so glad that the United States has rejected this.
Yeah, a lot of this information, as you pointed to, is really out there in the public sphere, yet not too many people know about it in such depth. Alex, once again, drawing on your ongoing research in this area, is there anything that you would add to this in terms of the treaty or the other agreement?
Well, I think Reggie's right on the money here. This really sets the stage between the International Health Regulation Amendments and the International Pandemic Treaty or Accord or Agreement. They call it different things at different times depending on who they're talking to. That really lays the groundwork for a global totalitarian system to control humanity under the guise of public health. And Reggie touched on something that's really, really significant that very few people have looked at yet, and that is the whole One Health idea. What they're doing here is they're conflating human health with animal health and the health of the environment. This is a very, very dangerous way. It is, of course, collectivist in that we no longer take the individual's health as the priority. Rather, we take the health of the group. But even beyond that, we're now talking not just about humans, but also about animals and the environment. And so I've spoken with some of the top leaders of the WHO about this very issue. They say now climate change, for example, is a public health concern, and we need to deal with these issues like we dealt with COVID. In other words, with massive emergency powers for governments working through the WHO to exercise control over our lives. And as Robert F. Kennedy pointed out very, very clearly in his statement denouncing this thing, he said the influence of the big pharmaceutical companies, various hostile foreign governments like the Communist Chinese is very, very pronounced. We saw the cataclysm that was produced during the COVID pandemic. We must make sure that doesn't happen again. So this is very encouraging, incredibly dangerous mechanisms that the WHO is working on. Very, very good news that the United States is not going to be participating for now, but we need to be thinking long term because they will be back if we're not careful.
And I do want to look ahead to further protections and or things to look forward to on this front. But just staying with this idea of the UN, the ideal of it, of course, and also the WHO was for global cooperation. And proponents also argue that these agreements and regulations are created to facilitate better cooperation. So, Reggie, if you could speak to that argument that you might need to lose some sovereignty, possibly, some people argue this, in order to maintain peace, for example, in order to save lives as the ultimate good. Speak to that.
Okay, so I think that even if that were true, and it's not clear to me that it is true, I mean, I think that sovereign nations can collaborate together on behalf of addressing international health issues. But the World Health Organization has a terrible record. During COVID, they botched it so incredibly. They parroted the Chinese Communist Party's lies that there was no human-to-human transmission, that we didn't need to stop flights from China. They just turned a blind eye to the fact that China would not really allow them to investigate in the labs in China. They agreed. They parroted the lie also that it was a bat or a pangolin and not a lab leak. And then they adopted the Chinese model of forced, vaccine mandates, mask mandates, lockdowns. So even if it were the case that we need to perhaps, give up sovereignty of some of it to effectuate some kind of a global response, it should not go through the irredeemably corrupt World Health Organization.
And on that point, I do want to turn to you, Alex, and look at the dynamics within the UN and the role of the Chinese regime there and how it's impacting the dynamics within the UN at the moment, just in terms of the regime's goals and how that's manifesting potentially within the WHO or other arms of the UN.
Well, the UN has fallen massively under the sway of the Chinese Communist Party, under the sway of the CCP, and that's not even up for debate. And there's something very different about an American going to work for the UN than there is about a citizen of Communist China or a subject of Communist China going to work for the UN. The CCP is very open about the fact that Chinese officials who go work for the UN are expected to first and foremost serve the interests of the Communist Party, first and foremost serve the interests of the CCP regime. And they've made that very clear on television. They actually arrested Meng Hongwei, who was the head of Interpol, when he refused to carry out CCP directives. And they actually said, as one of the reasons for arresting him when he returned to China, that he wasn't faithfully following his orders from the CCP. So when you look at the number of CCP members and operatives throughout the UN, and by the way, that very much includes the WHO. As Dr. Tedros was being selected for that spot, I was in communications with diplomats in Geneva who told me that the CCP was twisting arms to try to get him shooed in there as the leader. And I'll remind people that he's got his own long history of this kind of extremism. Before taking over in a very senior post in the mass murdering communist regime in Ethiopia, he was actually a member of the Politburo for the Tigray People's Liberation Front, which is an ethno-Marxist mass murdering terrorist organization so defined by numerous governments, including ours. So to have a guy like that helped into a position of power by the CCP is very typical of what we see going on in the UN. And I think that's one of many reasons why the U.S. government is being very wise here to reconsider its relationship.
And I wish we could continue this conversation further. I hope we do come back and touch base with you both on this. That's all we've got time for now. Reggie, Littlejohn, and Alex Newman, thank you so much for your time today.
Thank you for having us.